Now, it is that time of the week when we put your questions about coronavirus to health expert Dr. Bharat Pankhania. And we have had lots in this week, as ever. And he joins us now from his home in Bath. Wonderful. Always to see you. Thank you for joining us.
Hello.
And Dr. Pankhania, one of the things that's emerged in the past couple of days is new research that's coming in from France suggesting that people could have had the virus before Christmas. And actually, on social media, lots of people have been saying, did I have it at the end of last year? So do you think that was possible?
Indeed. And this is very interesting because people who have pneumonic illnesses, meaning severe chest infection, we often save their samples, and sometimes even the blood sample is saved for their inpatient hospital treatment. So it will be a very good idea to go back and look in these samples for presence of COVID-19 virus. It will tell us a lot. It will inform us. So I look forward to answers to, was this here well before January, for example?
Yeah, absolutely. I think a lot of people can because they were convinced. Now, the possibility of lockdown easing is coming, and we've had a question from 12-year-old Sarah. Thank you, Sarah. She says, my mum has an NHS letter and is high risk. I'm in year 12. I'm her carer along with my dad. If school reopens, is it safe for me to go back?
Yeah, it's a lovely question from the 12-year-old viewer. And it's really good to know that she's looking after her mum. That's brilliant. I would say we don't know, because we don't know the dynamics of children being infected but not showing any signs and symptoms, and at the same time being infectious. So we need a little bit more science and knowledge on this before I can say hand on heart that children going to school are safe, especially if they're coming home to vulnerable patients, vulnerable parents.
Would it change slightly? Sorry, my producer's just told me, year 12, she's actually 17. Would your answer still be the same, that we still need to wait and see?
My answer is still the same. You've got to wait and see, because there is a lot of uncertainty around the younger age group, whether they are transmitters of this virus or not. I would assume, empirically thinking, of course there would be. Why wouldn't there be, even if they show no signs and symptoms or minimal signs and symptoms? Therefore, the message is, we need to tread very carefully over here.
OK, so take caution there, I think, Sarah. And sorry, you just look so young for 17. Now, another question that we've had to regard to lockdown easing, I think people are quite anxious about it, aren't they, is it possible for a household that's been in complete isolation for 5 weeks to visit another household who have also been in complete isolation?
Yeah, that's a pretty good summation. So both the units are otherwise not having in or out of any other human beings coming to those two homes. Therefore, they are infection-free. And I would say, therefore, they are both clean units. And therefore, House A and House B would be able to meet, because there is no risk of A transmitting infection to B or B to A.
Yeah, absolutely. Of course, not yet, because lockdown's not over. There's been a lot of talk about face masks this week, and this question's come from Ingrid. She says that her 94-year-old mother lives in a warden-assisted residence and is visited by a carer. The carer doesn't wear a mask. Should she be instructed to, because she does attend other residents in the block?
Yes, without a doubt. My simple, emphatic answer is yes, you must, because people in nursing homes are very vulnerable to their carers, and it will be the carers or people coming in and out of those homes that brings in an infection to a vulnerable person, and then infection control in nursing homes is difficult. Therefore, we must have heightened infection control in reverse, which is I want these carers and people who are coming into nursing homes to be protected so that they don't infect the residents that they're looking after.
OK, so do wear a mask. A couple of specific health themes have come up. This one's from Alan, who asked, does having a flu or pneumonia vaccine offer any degree of protection against the virus?
No, of course not, because it gives you protection against the disease you have been immunized against. Having said that, it is always a good idea to keep yourself fully immunized, so update with your seasonal influenza vaccine and your pneumococcal vaccine if you are entitled and you need it. Always good to be up to date with vaccines. Unfortunately, there is no cross protection.
I'm glad we'd asked that, though, because it comes up every week, actually. And then this is from Sally. She wants to know your opinion on new research that says medication for high blood pressure can cause more severe symptoms of the virus. So if that's the case, she's saying, should she speak to her GP? Should people speak to their GP about changing blood pressure medication?
No, there has been a lot of conversation around these drugs like ramipril. These are ACE inhibitors, we call them in the trade, and there is no link between the ACE inhibitor, that's the blood pressure drug, and giving you a coronavirus COVID infection. No link. So just, I know they're related, but there is no direct link between them. So you must carry on with your anti-blood pressure treatment. It's very important you do.
Oh, I'm glad, because there's some mixed messages, so that's really straightforward. We're out of time. I wish we weren't. Dr. Pankania, thank you so very much, and hopefully you'll join us again next week.
Welcome.
Brilliant.
Thank you.
Thank you. I love seeing Dr. Pankania, and thank you for all your questions. If we didn't get to yours, perhaps you can try again next week, because Dr. Pankania says he'll be back. So thank you very much. Now, still to come tonight,